Today topic of discussion is vitamin B3 niacin. These are the other name of vitamin B3: niacinamide, nicotinamide, nicotinic acid and Velacra preventive. These are the other name. It is a water soluble vitamin and also known as nicotinic acid. The amide form nicotinic acid or niacin is known as nicotinamide or niacinamide. Amide form of nicotinic acid or niacin name is called as nicotinamide or niacinamide. Actually, it is not a true vitamin because there is partial synthesis of niacin in our body from the tryptophan. For the conversion, it required additional component like vitamin B2, B6 and iron. It required 60 mg of tryptophan give 1 mg of niacin. So there is partial synthesis of niacin in our body and rest of the requirement has to supplied in the diet. 60 mg of tryptophan, it required additional molecule B2, vitamin B2, B6 and iron. It will converted 1 mg of niacin. Next, biochemical functions of niacin. That active form or coenzyme form of niacin NAD plus NADP plus. So two important coenzyme of niacins are NAD plus and NADP plus. NAD plus is converted into NADH and NADP plus is converted into NADPH. They involved in various oxidation reduction reaction. In this reaction, they accept hydride ion molecules. Hydride ion means this is one hydrogen and one electron. By accepting this hydride ion, NAD plus is converted into NADH. So loss of charge. Then this NADP plus is converted into NADPH. Number of reaction catalyzed by NAD and NADP. There are number of enzymes which required NAD as a coenzyme starting from glycolysis. It is a coenzyme for glyceraldehyde 3-phosphate dehydrogenase. That means glyceraldehyde 3-phosphate is converted into 1,3-bisphosphoglyceride by the help of enzyme glyceraldehyde 3-phosphate. Then second one is pyruvate is converted into lactate by using enzyme lactase dehydrogenase. Then pyruvate is converted into acetyl-CoA with the help of pyruvate dehydrogenase enzyme. Then alpha ketoglutarate is converted into succinyl-CoA with the help of alpha ketoglutarate dehydrogenase enzyme. Then malate dehydrogenase. Then lipid metabolism like beta hydroxy acetyl-CoA is converted into beta ketoacyl-CoA with the help of enzyme beta hydroxy acyl-CoA dehydrogenase. Then branched chain keto acid dehydrogenase, etc. So it is a coenzyme for number of reaction. Number of enzymes. What are the enzymes? Glyceraldehyde, 3-phosphate dehydrogenase, lactate dehydrogenase, in Krebs cycle pyruvate dehydrogenase, isocitrate dehydrogenase, alpha ketoglutarate dehydrogenase, malate dehydrogenase, and beta hydroxyacyl dehydrogenase, then branched chain ketoacid dehydrogenase. These are the coenzymes for number of reaction. NADP, it acts as a coenzyme for glucose 6-phosphate dehydrogenase. This one is important enzyme. Then phosphogluconate dehydrogenase, it also required for malic enzyme. So these are the enzymes which required NAD and NADP as coenzyme. Then NADPH is required for number of reductive biosynthesis. Example, it is required fatty acid synthesis, cholesterol synthesis, vitamin D synthesis, and steroid hormone, etc. NADPH required for reductive biosynthesis process. Example, fatty acid synthesis, cholesterol, vitamin D, and steroid synthesis. NAD and NADP also required for supply of ATP ribose. It required for DNA repair mechanism. Now coming to dietary sources. Now coming to dietary sources, it is presented in veg and non-veg diet. Liver, meat, fish, legumes, whole grain cereals, dried yeast, tea and coffee. These are the rich sources. Poor sources in fruits, vegetables and corn. Next, RDA, men 15 to 20 mg, women 14 mg, pregnancy period 16 mg, lactation 18 mg, overall 20 mg per day. Deficiency manifestation: inadequate intake, alcoholism, chronic administration of drugs. The deficiency occur when a patient of tuberculosis occur in they will take treatment for INH. This one will inhibit pyridoxal phosphate. That's why it decreases the synthesis of tryptophan. PLP is required for kinase activity. It conversion of tryptophan to niacin. It associated with impaired conversion of tryptophan to niacin due to decreased activity of PLP dependent enzyme kinase. So these are the deficiency factors: inadequate intake, alcoholism, chronic drug administration. Example, the patient will take the treatment for tuberculosis INH. Next, moving to clinical features. Deficiency of niacins lead to clinical condition name is called as pellagra. Pellagra caused by mainly the tryptophan and niacin deficiency. So it causes disease pellagra caused by tryptophan to niacin deficiency. Symptoms: it causes 3 different type of D symptoms if not treated. If untreated, leads to final 4th D. What are the 3D symptoms? Dermatitis, diarrhea and dementia. Dermatitis, diarrhea and dementia. Dermatitis, it is a early stage bright red erythema occur in feet, ankle and faces. It increases pigmentation around the neck. So that condition name is called as castle necklace. Then dermatitis is precipitated by exposure to sunlight. Diarrhea, mild or severe with blood and mucus, leads to weight loss and it causes nausea and vomiting. Dementia leads to irritability, inability to concentrate and poor memory. If not treated, means final 4th D leads to death. Niacin notes format. Thanks for watching.